Good afternoon, everyone. Thank you for your time. Thank you for spending your lifetime with me. And I hope all of you have gotten your lunch, at least grab a drink and sit back and relax as we sort of explore the world of digital mental health together. So, as Emily introduced, my name is Caleb. And at home, I'm a father to two children, two young girls. And at work, I lead partnerships and engagement for Mindline.sg. So, a bit about where my workplace is and what Mindline.sg is. I work for this organization called MOHT. MOHT stands for Ministry of Health, Office for Healthcare Transformation. It's a very long name. I don't expect you to remember it, but essentially we are a unit within MOH that looks at experiments and pilots and ways to improve the healthcare system through innovative technology. Right, so one of the projects that we work on is called Mindline.sg, and that's what my team does. And through Mindline.sg, we try to improve the mental health of Singaporeans. So this is, in today's session, I'll be talking a bit about, how we, about the landscape of the digital mental health in Singapore, some of the tools and some of the ways that Mindline.sg is supporting Singaporeans' mental health. But before we start, let's talk about something that has affected all of us, COVID-19, right? I think over the last 3 years, most of us would have had some story to share. There are a lot of research talking about how COVID has affected our mental health. You can see snippets of different news articles here saying that Singaporeans are socializing and dining out lesser. As a result of that, our mental well-being has declined. Even for youths, there are a lot of challenges, even official studies from IMH as well. It points to a lot of different mental health issues in Singapore arising from COVID-19. Again, I wouldn't bore you with all the research, but here are some of the numbers for those of you who are very numbers driven. So you can see our social life compared, before circuit breaker and after circuit breaker. Most of us, our social circle has shrunk. We only talk to people who are very close to us. We don't talk to as many people as we did. We also socialize lesser. But I think the good thing now is that as we reach the tail end of 2022, the COVID situation has somewhat stabilized, and I think a lot of us are now going out to talk to our friends, etc. So I hope from here onwards, our mental health would sort of be a bit better. But coming back about COVID-19, I have a couple of stories to share. Right, COVID-19 has been here for about 3 years, and it has been affecting me and my mental health for the past 3 years. So when you think about mental health, what do you think about? For me, mental health is something that is very, very simple. Mental health just means being happy. Of course, there's a whole spectrum of what mental health means, from being happy all the way to sort of dealing with certain issues, certain diagnoses, right? But for me, mental health, being mentally healthy just means being happy. And over the last 3 years, I just thought I should do a quick sharing before we go into the more technical parts of the webinar. Here's my COVID story, right? So over the last 3 years, you can see this is a very interesting chart. There are ups and downs across the last 3 years. And ups are obviously when I feel happier, and downs are obviously when I feel less than ideal. So 3 years, 3 short stories to share. I remember at the start of COVID, right? I was still working in a consulting firm, and as consultants, we often have to think about, this new virus that started in China, right? How long would it last? What kind of impact would it have? And we all kind of dismiss COVID-19 as a very small thing. One of my colleagues who had a lot of experience in infectious disease said that, I think COVID-19 probably run by summer, just like how SARS did. But apparently it didn't. And on the day that PMD drank from his magic cup, he announced this thing called circuit breaker, and that was really the start of a lot of mental health struggles for me. And so I mentioned earlier that I have 2 young kids. So one of them is at that point in time, one of them was 4, and one of them was still in my wife's womb. Right, so she was not born yet. And my 4-year-old was obviously very puzzled. She asked me a lot of things like, why do we have to stay home? I hate staying home. There's nothing to do at home. Why do I have to meet my classmates online? That's such a new experience. I hate it. And I, as a parent, on the other hand, was frantically Googling, how do I entertain my 4-year-old? So as I was searching for answers for my kid, I could also see that her mental health was drastically affected. At some point in time, she would be sitting in one corner and just looking really, really sad because she said, I cannot talk to my friends, I cannot play with my friends anymore. And that's really, as a parent, I think that's one of the worst things that you can feel. And to add on to that kind of stress, I think at the point in time it was still okay. And to add on to that kind of stress, my second child was born during circuit breaker. So she's officially a CB baby. I think it's a joke that many of us can sort of relate to. But the stress that comes along a child that was born during circuit breaker is that there was no confinement resources available. If you remember at that point in time, about 2 years ago, there were no visits allowed. Everyone was at home. Even my parents couldn't come over to sort of look after the kid. So imagine two young parents looking after a 4-year-old and a newborn, and we had to learn how to do confinement ourselves. And I was just like, oh man, like what do I do? But as I sort of, calm myself down, the one thing that I learned to cope with my mental health was to change my environment. So as you can see from this picture, right, this is me at the top of Mount Faber with my baby in front of me. Right, this was one of the ways that we changed our environment in order for us to feel a bit better. And of course, that was one of the few places that we could take off our mask. So we went there quite often, sort of to relax ourselves, to be able to breathe some fresh air. So that's 2020. In 2021, again, COVID-19 was still a big thing. In between, it was still okay. There was some ups and downs. But in 2021, there was a period where there were many clusters, and unfortunately, my house, the area around my house was one of the clusters. And for some reason, I don't know why, I didn't get COVID at the point in time, but I got confined and I got quarantined because someone, I guess, in my block had COVID. And if you guys remember, block 119 Bukit Merah View, that's where I stayed in the past. I don't stay there anymore. But that was one of the biggest COVID clusters at some point in time. And we had to be chauffeured to this place, right? This is a chalet, and we stayed there for a month, right? And the reason why we stayed there for a month was because I had quarantine for 2 weeks, and at the end of 2 weeks, my helper, my maid, got COVID, and we had to be quarantined for another 2 weeks. So all in all, it was 1 month of quarantine, and it was no fun at all. I couldn't work, couldn't think of anything, and we were chauffeured to this chalet. And the best thing about this chalet is that my kids thought it was a holiday, right? So when they went there, you'll see that, oh, this nice chalet is 2 stories. There was a huge staircase in the middle. There was a small jacuzzi at the back. The kids thought it was a holiday and they loved it, right? So they were climbing up and down the staircase all the time, and they had the best times of their life. But the adults were really stressed because at the point in time, I was also trying to move houses. So because of that 1 month quarantine thing, I couldn't move house. I had to move house virtually. So I had to coordinate for the movers and also the renovation all virtually, and it was super stressful. And every day it was just me, looking after the kids climbing up the staircase and down the staircase, going to the jacuzzi and doing the same thing over and over again. And at the point in time, we tried to ask for help, but it's very hard to find help because most of the day, you are preoccupied with a lot of things that are happening, in this quarantine, right? And that's where I guess, when you have some time at night, you can start to browse certain resources, and that was how I coped for my mental health. And in 2022, finally I got COVID, and then sort of my mental health went up from there. I finally got COVID. I'm part of the club, and everything got better. So I guess the moral of the story here is that even as sort of someone who is working in the mental health space, I'm not free from any mental health struggles. I'm just like most of you. I think we all have stories to tell. We all have some COVID-related story. And I guess the important thing is to be able to find your flow, change your environment and prioritize self-care. So that's sort of like, I thought I should just set the stage about, how COVID has affected all of us and our mental health. And you'll find that later I'll explain, how Mindline started. Because a big part of how Mindline started was because of the COVID-19 situation too. So if there were 2 things that came out positive, from COVID, is that first of all, I think Singaporeans as a whole, we are a lot more digitally savvy. My 80-year-old grandmother can now use, Trace Together, can now use Safe Entry. She now knows how to use a mobile phone a lot better than she did pre-COVID. My mother, 60-year-old, can now use telemedicine, and talk to a doctor online. He's not so skeptical about talking to a doctor online. And I guess the other positive thing about COVID-19 is that there's a lot more emphasis on mental well-being, pre-COVID and post-COVID. So I've worked most of my life in corporate well-being consulting. So I used to joke around to my clients and say, oh, COVID helped me keep my job because of COVID, a lot of things that I do are suddenly a lot more relevant. A lot of companies are looking at wanting well-being interventions a lot more. And as a result, I get to keep my job. That's one of the jokes that I always tell my friends, but I think that's very true. So according to research, there's an increasing trend towards digital solutions, for mental health, whether it's in Singapore and globally. There's a lot of funding, there's a lot of startups. I think over the last 2 years, there are many, many startups in the space of mental health. And even for Singapore specifically, in Singapore, in such a small nation, we have very limited human resources. So we have very limited therapies. We only have so many psychologists. We only have so many psychiatrists, and there's not enough for everyone. As a result, we need to use technology to be able to help us improve our mental health, right? So again, experts, not myself, recommend that mental health supports such as apps, chatbots, online self-help, and even different kind of helplines need to be further tapped on in order to cater for the increase in demand for mental health services. So when it comes to digital mental health services, and this is something that I'm very, very passionate about, I just completed my master's in public health, and so my research topic was on mental health apps. Right. So when it comes to mental health apps, there are many different kinds of mental health apps. But first of all, when we think about mental health interventions, there's a spectrum, right? So if you look at the top row, you'll see that there are interventions relating to promotion and prevention. This means giving you information, telling you how to live a healthy life, etc. There are solutions that cater specifically to detection. How do you know if you are at risk of depression? How do you know you're at risk of anxiety, for example? There are solutions that give you support and treatment, and there's solutions that help you manage. After you get a diagnosis, how do you manage your condition and how do you recover? So there are many, many different kinds of solutions, and what we've done here is to sort of put them into 9 different types. So type 1, you have your one-stop shop. So this is applications or platforms that does everything. They do everything from 2 to 9, right? So these are far and few between, right? When it comes to sort of type 2, so these are platforms that give you a lot of information. So things like education, they give you articles to read, they give you resources to visit, they give you websites to look at when you need certain help. Type 3 are things like personal health trackers. So if you're familiar with your Fitbit, even in Singapore, your HBB, your Healthy 365, these are health trackers, right? So they help you track the number of steps you take every day. They remind you to log your mood and track your mood over time. If you are sort of diabetic, for example, they remind you to track your blood sugar, etc. So these are health trackers. The other type are meditation and mental wellness apps. So these are apps that give you guided meditation. So you listen to the app, and then they will bring you through some sort of intervention, some sort of guided track, and say that, okay, now close your eyes and do certain things. Type 5 is a bit more popular with youth. So mental health games. It might seem a bit counterintuitive, right? Say, let's play a game for mental health, but it's actually true. There are a lot of mental health games nowadays, and most popular with youth. They are designed to help people with their anxiety, cope with their depression, etc. And of course, there are those that type 6 are those that help you with assessing how you feel at the point in time. Type 7 are the kind of platforms that give you guided therapy. So what I've described from type 1 to type 7, these are somewhat of a self-help. So when you feel that you are at risk of something, you go there and you try and assess something, you try and help yourself. And types 8 and 9 involve some level of human, right? So as I mentioned earlier, that there are very, very few humans in Singapore, right, as compared to other countries, of course. So we don't have enough psychologists, we don't have enough psychiatrists. So how can we help them to do their job better? So this is where the element of human support comes into play. So type 8 is where you have things like online peer support, like someone who, if you are someone who needs help, you can go online and look for someone who can provide you a listening ear, for example. And then type 9 is where you speak to professional therapists, counseling, and coaches, whether is it from an individual level or from a group setting. So these are 9 different types. Again, there are many, many apps out there. In the Singapore landscape, right? So this is how it looks like. Again, these are just illustrative examples I just put some of these, you'll see that across the spectrum, a lot of apps, right, are focused towards the left, right, towards more towards promotion, prevention, detection and assessment. That's because the support and the treatment as well as the management and recovery side of things require a lot more human intervention. So this is how the landscape looks like. You'll see Mindline.sg right in the middle. Of course, there are different types of apps as well. So you have those that are consumer driven, so meaning you pay, someone pays for it, and then there are those that are sort of funded by the government, so health and social sector, and that is sort of free at low cost to users. So let me just share a bit about our Mindline journey. So I mentioned earlier, in 2020, COVID hit us, right? And that was when Mindline.sg started. So I wasn't here at the point in time, but as I understand from the sort of the team who first developed this, they wanted Mindline.sg to be a resource repository to help Singaporeans cope with the pandemic. So I think during the pandemic, many Singaporeans were facing a lot of stress. There was a lot of issues around caregiving, as I face. A perfect example would be that 2 young kids, caregiving resources. They wanted people to be able to cope with unemployment, for example. So if you are unemployed, if you're retrenched, where can you go to improve your mental health? Of course, we don't just tell you, hey, improve your mental health. We give you resources. Where do you get funding? Where do you get grants? Where do you look for another job? Now, these are ways to go down to the root of the problem. And this is how we want to help fellow Singaporeans. So Mindline.sg was born June 2020, and we aim to serve the general population from there. And as we move across the months, we thought that, okay, you cannot just be a resource repository because people are quite sick and tired of reading information, right? There's so much information nowadays. There's an explosion of guides and tips, etc. So we partnered with this company called Wiser, and we incorporated an AI chatbot into our platform. So Wiser is essentially an AI chatbot that is there to help you, and that is there to listen to you and provide you with some advice and tips. Of course, you cannot solve all your problems, but it's there to listen to you. As we move into June 2021, this is where we started thinking, okay, perhaps it's time for us to dive a bit deeper into different population segments. And the first population segment that we wanted to look at was working adults, because working adults form the bulk of our Singapore population, right? It's about 3.7 million people strong. And we worked with the Public Service Division to come out with this thing called Mindline at Work, right? Mindline at Work aims to be able to provide resources and tools and tips for working adults. Whatever stresses that you're facing at work, whether is it difficult conversations or conflict management, you will be able to find some support on Mindline at Work. And then in 2022, every year we develop something new, right? So in 2022, what we're focusing on is the youth segment. So we've just recently launched our Youth Mindline platform. And again, this is a platform that's targeted towards youths aged 17 to 25. And through this platform, we hope to be able to engage some of the youths and help them address some of their mental health issues. Right? So for those of you who are parents or who work with youths, this could be a platform that they could look at. So if I can take a pause here from speaking, and I would like to invite all of you to scan the QR code on the screen, right, and try out Mindline for yourself. If you don't want to scan the QR code, you can also click on the link in the chat. Right, so this will bring you to Mindline at Work, which is a version for that I think is applicable to most of you online. I think most of us online are working adults, so this will be the version that's most applicable to you. So if you could take a few seconds to try and scan the QR code and play around with the platform, I will come back in a short while. Okay, I hope all of you have had the chance to scan the QR code, or if not, click on the link in the chat. So let me bring you through a bit of what we do, right? So the Mindline experience essentially can be summarized into 5 different things. So first of all, Mindline is a completely anonymous platform, right? So we don't ask you for any email address, we don't ask you for anything, right? So it's completely anonymous. You can feel safe when you sort of go onto the platform to look for any resources. But at the same time, right, we do ask you a few questions. What is your age group? What is your life stage? And what are some of the things or topics that you're interested in? in order to provide you with a customized experience. I think here at Mindline, we take user experience very seriously. So we want to be able to make sure that we give you what you need at the right time. So on the platform, there are more than 500 specially curated articles, videos, a lot of resources that you can view. We also have an assessment. So for those of you who are thinking about, maybe I don't need this, or I don't know how I'm feeling, right? You can do a quick emotional health check-in. This is a clinically validated assessment that helps you to understand your risk of depression and anxiety. And through that, right, we give you recommendations on the kind of resources that you should be assessing. And of course, the last part is our pocket AI therapist. This is where we have Wiser, and Wiser is there as your sort of 4 a.m. friend. So the example that I gave in my story earlier on just now, right, is when I was in that chalet in quarantine, I was sort of overwhelmed during the day, right? I was overwhelmed. I had nobody to talk to other than my wife. And by the time I had time, it was 12 midnight. And all my friends are already asleep. There's no one to talk to at 12 a.m. All right, so you can talk to Wiser. So this is one example that you can use Wiser. Someone says the website is not loading. Oh, okay, website is loading now. Okay, great. So to share a bit about what we try to do with Mindline, right? So first of all, we try to increase awareness. This is very important, right? So you need to first understand and acknowledge that there is this thing called mental health before you can progress further. Right? I think Emily is happy to share the link again. So first of all, you want individuals to understand, that whatever that they do affect their own well-being. We want them to be able to understand a bit more about how they feel through the self-assessment tools that we have, self-help tools that we have. And we also want them to understand that there are a lot of support channels that are available for them, different kinds of counseling, different kinds of peer support, etc. But understanding is not enough, right? So we want people to be able to do, right? So we want people to be able to take action and practice self-care. So through our platform, right, so we provide a lot of small actionable items, right, to nudge users towards taking action. So you can be doing assessment, you can be chatting with Wiser, you can be reading an article, for example. We try to make it as easy and as seamless as possible for users to be able to take action. And lastly, right, what we want to do is to be able to sustain the behavior. Right, so this is where I guess a lot of my work comes into play. We try to go out to different events, go out to different platforms, work with different partners to integrate Mindline into existing program. So one example, right, was our partnership with Active.sg. And when you think about Active.sg, you think about sports, not very relevant to mental health, but in fact, it is very relevant because the way you do sports, when you exercise, you release endorphins, it helps you to feel better, it helps you to think clearer. So one of the examples that we worked with Active.sg was to develop this thing called a Mindline Trail. So users who use the Active.sg app who are interested in sports can also try out some mental health activities. So again, this is where we try to help people maintain their wellness behavior, right, by seeing Mindline everywhere. So that's our idea. Okay, so when we think about sort of building something, it cannot just be Mindline as a standalone platform. It needs to be an ecosystem, right? So if you take a look on the left side, you see things like self-help therapy, you see things like peer support, you see things like professional support. So as we try to build Mindline, we try to sort of layer upwards. So first of in the first layer, you see things like therapeutic content, right? So therapeutic self-care content, when this is applicable for you when you are feeling maybe a bit stressful, but generally well, right? If you feel okay, you can talk to a chatbot, or you can go online and talk to some people who are like you. So this is where you connect with your virtual communities. So these things would fit the people who are well to at risk. And then we move on to people who are a bit in the subclinical stage, who are at moderate risk of developing a mental health condition. Right. So this is where you might need some level of professional support. These are things like having digitally enabled counseling. So how can you link to a counselor through telemedicine, for example? And of course, at the top part, where you really need treatment, this is something that you need professional help. You can't do it yourself, right? So Mindline, again, we don't try to do everything. Mindline trying to do some things, right? So we focus mainly on the self-help therapy portion, but as we sort of build upwards, right? What we're trying to do is to be able to refer users to different kind of professionals whenever you need help at the right time. Okay, so this is how we are thinking about building the ecosystem, and this is applicable to anything that you see. Everything has to be an ecosystem. We are at this age now where none of us can work alone. All right, no man is an island. So we need to be able to work with partners, work with different stakeholders in order to build a robust ecosystem. And to share a bit about our design principles, right? So I hope most of you scanned the QR code just now. What in our research, we found that most of our users, they look at websites on their mobile devices, right? So design for mobile first. And the reason why we don't have an app, right, is because what we realized in our research is a lot of people have a lot of hesitancy when it comes to downloading apps. Like in my past life, when I was doing wellbeing consulting, and I tell people to download apps, the first reaction is, download another app. How much space does it take? No, my phone has no space. My phone space needs to be reserved for all my photos and everything. So I think there's a lot of hesitancy in terms of downloading apps, and that's why we conscientiously designed Mindline to be a website, but a website that is mobile friendly and a website that is able to deliver the correct experience to you. And so some of our other design principles, like being user-centric, so we design with the user in mind. We do a lot of feedback and ask users, hey, what do you think about the font? What do you think about the color? What do you think about these features, that feature, etc.? All right. We also want to have a very clean and intuitive interface. That's why a lot of resources that you see on the site is not bam, upfront, right? We ask you some questions along the way so that we can curate the resources for you. We give you the most relevant ones upfront so that it is applicable to you. We don't want you to browse resources that are not applicable to you, and then you get sick and tired of the platform. We also have, we also try to incorporate personalized experience. So if you are on the platform, if you try to do a mood check-in, for example, you say that I'm feeling sad, then we will address you by your name and say, sorry to hear that you're feeling sad. Here are some resources that you can access. So we try to give you that kind of personalized experience so that you find what you need very quickly. Of course, as a government organization, evidence-based content is very important. So we differentiate ourselves by getting our clinical review panel to review the kind of resources that we put online. All right, so this is extremely important to us to make sure that there is sufficient validity in what we provide. And of course, being future-proof. So being a platform-based service, right? So it's important that we integrate we are able to integrate with other platforms. We're able to adapt and move accordingly. So this is extremely important to us so that we do not become an obsolete platform over 2 years, right? So these are some of the design principles. I see some questions that are raised, but I will answer them later. But so feel free to keep your questions coming. Just to explain a bit more about the different kind of features, right, that are available. If you are on the site itself, you might have come across this thing called the quick emotional health check-in. So this is a clinically validated depression and anxiety questionnaire. So it's got PHQ and GAD-7. And what we try to do is to ask you a few questions, right? So we first ask you 4 questions, and try to assess how you're feeling. If we assess you to be well or mild, that's good. Then we'll give you some resources. But if we assess you to be a bit more at risk, we'll ask you a bit more questions so that we can determine your level of severity, right? So this is how it works. So after you answer all the different questions, we try to bucket you into different protocols. So if you are considered well or mild, the kind of resources that we propose to you would be around self-care habits. How do you build mindfulness? How do you practice meditation? Perhaps do some gratitude journey, for example. If we assess you to be moderate, right, so we will share some help services that you can reach out to. And if we assess you to be in a crisis mode, right, so we immediately give you the crisis helplines because there's nothing that Mindline can help you if you're in a crisis. We need to be able to guide you to call the SOS helpline immediately. And this is the thing that comes up. There's only this thing. Call this number to make it as clean as possible so that it's very easy for you to call and seek the help that you need. So this is how the emotional health check-in looks like. I mentioned about our sort of AI chatbot. So an AI chatbot, right, is there to listen to you, but it's not there to solve all your problems, right? So for example, if I say that, I'm facing issues with my kid is being very stubborn, being very difficult, the AI chatbot can't make my kid easier to handle, right? But what the AI chatbot can help me to do, right, is to be able to listen to my sort of my situation and give me some tips, right, to reframe the situation. Perhaps there are certain things that I have not considered. Perhaps there are certain things that I could be doing a different way to talk to my kid, for example. So that's what the AI chatbot is there. There are a lot of self-care and cognitive behavioral therapies, therapy exercises that are available. So one thing to note, right, is that Wiser is actually a paid service, right? So if you download Wiser overseas, you have to pay for it. But in Singapore, what we've done is to make it free for everyone. We've negotiated a national license for everyone living in Singapore. So if you access Wiser through Mindline.sg platform, you get it for free. Everything, all the premium features. So I mentioned that, again, different kinds of specially curated resources. So this is for Mindline.sg. So when you sort of go into Mindline.sg, you see things like, oh, I'm not feeling safe at home. I need financial support. This is how we filter the resources based on your kind of needs and your kind of life situation, right? So the parent, my first thing will be, I need caregiving support. I'll click that, and then they'll ask me a few more questions. Oh, I need parenting support, and then I'll get all the parenting resources that I need, right? Similarly, if you're someone who is looking after an elderly, for example, you could be clicking, I need caregiving support. I need to care for an elderly, and then you get all the elderly support resources. But again, these are all customized to your own needs. And for Mindline at work specifically, so these are, again, different kind of situations that we face at work. So sometimes we need to practice self-care. Sometimes we need to improve our own effectiveness or productivity. For those of us who are in leadership positions, we need to take care of our team. How do we do that? Right. So if you click on that, there are different subtopics. You can click on the subtopics of your interest and go into the resources directly. There are also some comics. So for those of you who are into comics, what we realize is that sometimes our platform, right, because it's very information heavy, can get a bit tiring to, right? There are so many things to look at. So the feedback that we got from some of our users is that, oh, maybe you can put in some comics, right? Get people to have a laugh at work. So this is where we put in comics. I think some of you might recognize the style of this. This is like the Straits Times guy who helped us with some comics. So you can read this. These are all work related, and hopefully it gives you a good laugh after that. Many different types of resources. So you have your articles, you have your videos, you have self-care exercises, and you have quizzes. So different colors. Of course, when you click into one of them, you'll see that. And what we try to do, as I mentioned earlier about user experience, we realize that a lot of people don't read full articles. What we try to do is to bite-size some of these articles, put them in point form. So if you click on most of the articles, right, you see that there is this summary page. So for example, the one you are seeing on the screen says surviving your first day at work. There's tip for day 1, tip for day 2. You just read the few points. You don't have to read the entire article. But if you feel like reading the entire article, you can click on it and go to the full article. Because it's very important for us to make sure that people are still interested on the platform. We don't want you to read or click on a page on Mindline and then, oh my God, there's so much things to read. So this is how we try to streamline your experience and make it easy for you to browse the website. And I mentioned earlier that we are very excited to launch Youth Mindline recently. So Youth Mindline is another edition of our product suite, and this is applicable for youths between 17 to 25. So if you have children around the age, or if you work with youths around the age, this could be applicable to them. So similarly, I think youths compared to my generation are a bit more accepting and a bit more aware of mental health. And so again, the kind of stresses, the kind of issues that they face would also be very different. So through about 6 months of research with youths, we co-created this whole platform with them. And this includes things like customized resources. Again, you'll see here things about discovering themselves, understanding their relationships. School and work is also a big part of our youth's lives. How to become an adult, how to be independent. Adulting is again a big topic. We also have this thing called Let's Talk. So I'll share a bit more, but essentially Let's Talk is our first foray into two-way interaction. I think when you think about most digital platforms, they are mostly one way, right? So you go there, you assess something, but with Let's Talk, with this community forum, it becomes a two-way interaction. So I'll share more a bit about this later. So within Youth Mindline, again, there are, as I mentioned, there are different kind of resources. You have your strategies to cope with different kind of challenges in school, work, relationship, etc. You have your self-care exercises. I think youths nowadays are very into self-care exercises. And you also have signposting to community resources. And these community resources are youth-focused agencies. So that's, again, most relevant to the target audience that we are providing for. So Let's Talk. Let's Talk is a community forum. So this is essentially, if you're familiar with Reddit and Quora, so this is a mix of Reddit and Quora. So on the platform itself, youths can do a couple of things. They can ask a therapist. What we realize in our research is that a lot of youths, they have a lot of questions about mental health, but they don't have the resources or the courage to go and seek professional therapy, right? So it takes a lot of courage to go and say that, okay, I'm going to see a counselor, I'm going to see a psychologist. It takes a lot of courage. So what we try to do with this platform is to be able to provide them with a base level of support so that they can ask any mental health questions that they have to our therapists. And one of our therapists will come and answer on the platform. Again, adhering to sort of our principle of anonymity. Everything on the platform is anonymous. So when a youth asks a question, they remain anonymous. They don't need to reveal anything about themselves, and they can ask a question. All right. So this is, I think, for those of you who are also as old as me or older than me, there's this thing called Ask Aunt Agony, in those magazine columns in the past. This is like a digital version of it. We also have Hangouts. Hangouts is where youths can go there and discuss about certain things. Right? So they can discuss about the latest incident, for example, the Itaewon incident last night or 2 nights ago. That can be something that they can discuss about, or they feel very shocked at the incident, etc., etc. Again, on the platform itself, there's also a few other things like fun activities, wellness events, and chat rooms. So chat rooms are something that we are reserving for partners. So that's not open to public, but essentially it's still a feature on the platform. So how does the Let's Talk interface look like? So it looks exactly like a forum, right? So when users go into the platform, they can sort of post their questions, they can interact with professionals, and professionals will be identified with a tag so that they know that, this answer by this person is validated. It's a professional, it's a verified therapist, right? On the platform itself, we also have peer supporters. So peer supporters are people that we recruit from schools. Nowadays in schools, there are a lot of peer support curriculum. So people who are trained to identify signs in their schoolmates or classmates, or maybe you're feeling a bit stressful. I'm a peer supporter, I can help you. By listening to you, by providing you with some tips and advice, and by signposting you to some resources. So this is what peer supporters do. And what we're trying to do here is to be able to have an online community of peer supporters. And the last part about moderation, as with any sort of community forum, moderation is extremely important. So what we try to do is to be able to moderate the platform sufficiently so that meaningful conversations can take place, right? So if there's someone who says vulgarities on the platform, it gets automatically censored. If there's someone who is a troll, who is saying stupid things, right? We can ban the user, we can flag the user, not just us, but also people on the platform. They can also flag the user for review. So again, some of these things, as I mentioned, content moderation, crisis protocols. So these are things that we have incorporated into the platform. And one of the things that I really wanted to share is that we did beta testing with one of the students in RP and TP. And this person, I don't know who this person is, but this is more of the most encouraging messages that we've received. Right? So this person said that after being on this platform for 4 weeks for the beta testing, they now have gained the courage to go and seek professional help. And this is one of the little things that keep us going, because again, as a platform, we don't try to solve all the problems. If we can make people move in the right direction, I think we have sort of achieved our goals. And I think this is, again, one of the great testimonials for us, and really keeps us doing what we are doing. So I guess, as a summary, right, I think that's pretty much all I wanted to share about Mindline. And I think as a summary, it's very important to know that there are a few things. So mental health is is coming your way. So there's going to be a lot more emphasis and awareness about mental health. So if you are someone who works in the space, or if you are someone who works with people, keep this in mind. Digital transformation is also coming our way. So there's going to be a lot of digital transformation in the space. So putting these two together, digital mental health, right? So again, this is something that we all need to be aware of. As someone working in the space, we are also not free of the mental health struggles. We also have to look after ourselves. And after this sort of session, I hope that you've gained a little bit knowledge about what mental health is, what are some of the platforms out there that are available to address this issue, right? And hopefully you can share about Mindline with some of your friends and people in your network. So I've come to the end of my session, and thank you so much for staying through. I'm going to have to ask you to do a quick survey, give us your feedback, let us know how the session went. There are things that you like or dislike. Scan this QR code or just click on this link to give your feedback. In the meantime, I will take a look at some of the questions that are being raised, and I can try to answer them. Okay. So we have a question about, can I share how I customize the content for certain target groups? Do you work with psychologists or use NLP? One complaint with AI chats is that the response can be robotic or irrelevant. And do you have a way to capture instances where users found this to be the case? Okay, so there are a few sort of questions in this question. So let me try to address them one by one. So the way we customize the content with the target groups is by working with the target groups themselves, right? So for example, when we say working adults, we speak to the working adults, we conduct focus group discussions with the working adults to find out what kind of content is relevant to them. Of course, it may not be down to the specific article or the specific resource, right? But essentially on a high level, kind of understand the kind of topics that are important to them, and that's how we prioritize and customize the content accordingly. Besides working adults, we also have the youths one, we have the healthcare workers one, we have the teachers one. So all of these content are customized with target group, right? So teachers, for example, we work with teachers to customize the content, etc. We work with psychologists as well. So in our team, we have a couple of psychologists, and we work with them to be able to provide the kind of knowledge. The way we streamline our content is so that we have sufficient awareness. So if you think about the model I spoke about earlier, our care model, so we want people to be aware, we want people to take action, and we want people to be able to sustain their behavior. So our content is structured along the lines of achieving these goals for the user. So I totally agree that AI chats can be robotic and irrelevant. One of our guiding principles for AI chat, right, is that we try to do no harm, right? So we try to configure our AI chats to make sure that we don't do any harm. It may not be able to help you at a point in time, but we want to make sure that we don't do any harm to you. Again, this is something that must progress with times. I think at this stage in the whole industry, AI chats are still at a very nascent stage, right? So natural language processing, yes, we do use that, but we don't do this thing called generative models, right? So when you think about natural language processing, sometimes in other chatbots, maybe the banking chatbots or some other chatbots, for example, they take whatever you say and regurgitate that to you. So that's called a generative model. We don't do that, especially for mental health, because mental health is very sensitive, right? And we don't want to be giving you wrong advice, right? If you say, oh, I'm going to jump off the building, the bot should not say, okay, please jump off the building. So that's not what we want to do, right? So that's why the scripts in our AI chatbot is all manually scripted, right? It's all manually scripted and reviewed by psychologists, right? So that whatever that comes out of the AI chatbot, first of all, does no harm, and second of all, tries to help you a little bit, right? I can never say that it will solve your problem, right? It doesn't solve everyone's problem, but it can try to help you look at things from a different perspective. So I hope that answers the question about the AI chatbot. And yes, we do have feedback surveys. So on the platform itself, after every conversation, we try to ask people to rate the conversation. We try to ask people to provide some feedback about how they feel about the chatbot, right? And from the feedback, we try to adjust accordingly. So that's what the chatbot is. We have another question about, does the self-assessment app provide multi-language platforms? Unfortunately, no, at this point, but it's something that we are looking into. I know Singapore is a multi-language society, right? So we have a lot of diversity, and we are looking into providing multi-languages. But again, translation takes a lot of time, and translation in the right sort of context also takes a lot of time and governance, right? So it's something that will come, but it's something that is not available at this point in time. Is Mindline at Work free? Mindline at Work is free, so you feel free to share this with your organization. You can just go to the website Mindline.sg or /workspace. That's the link for Mindline at Work. Alternatively, you can get your organization to sort of email me. I can provide you the link as well. So it's a public link, so there's no cost to it. It's provided for by the government. You can just access it. All right. There is no Mindline app. So I think I explained earlier. So we conscientiously not develop an app because we realized that a lot of people don't want to download app. There's a lot of inertia to downloading apps. So it currently remains as a website and will remain as a website, so that most people using their smartphones, they can access it, access Mindline through the browser. Okay, there's a longer question. What made MOHD choose PHQ-9 and GAD-7 over Burns Anxiety Inventory and Burns Depression Checklist? And the reason why you ask is because PHQ and GAD are funded by Pfizer and they have a large financial stake with chemicals. And hence, the doctors who came up with this would definitely be influenced. Okay, while Dr. David Burns is free from bias. That's a very good question. I think there are many tools out there that can achieve similar outcomes. I think the reason why we choose PHQ-9 and GAD-7 is because of the variety of contexts and a variety of scenarios that it can be applied to. I think one of the things that is very important in choosing which assessment tools is that it needs to be applicable in many settings, right? So the reason why we choose PHQ-9 and GAD-7 is because of the way that it can be applied in different kind of scenarios, and it's also sort of free for sort of public use. I'm not exactly sure about the commercial model for the Burns Anxiety Inventory, but it's something that I can check it out. But that's the rationale behind why we chose PHQ-9 and GAD-7. Okay, so moving on to the next question, how do we get people in need to accept help? Well, this is a very tough question. Okay, so from my perspective, and this is again just my perspective, right? And just want to caveat, I'm not a psychologist. I'm public health trained, but I'm not a psychologist. I'm not a clinician. But in my opinion, right, when it comes to getting people in need to accept help, I feel like the most important thing that you can help someone who is in need of help is to listen to them, right? So just to give you an example, right, my wife sort of has some risk of depression, and she is extremely skeptical of mental health support. And this is very weird for someone like me who works in the mental health space. I'm like, oh, why don't you want to go and see a counselor? Why don't you want to see a psychiatrist or psychologist? And the thing is, they don't feel like that's what they need at the point in time. And the way that as sort of a caregiver or as a bystander, the way you can help them is really just to listen to them. Right? You may not be able to get them to do what the society thinks is helpful, because they think that it's not helpful to them. So I always feel like people know themselves the best. Some people might disagree, right? But I feel like the most important thing is to still to be able to listen to them, offer that listening ear, and help them when they need help. Right? So some people are not ready to accept help at that point in time. So there's no point in forcing it down their throats because it will be ineffective, right? So again, listen to them, offer your help, but don't force it. That's, I guess, how I would summarize it. Any Mindline for seniors? Something we have thought about, but not yet. So we have currently Mindline for everyone. We have Mindline for working adults, Mindline for youths, but seniors is a segment that we are looking into, but not yet. I think the reason why we have not looked into Mindline for seniors is because language is obviously one of the key things. Just now I mentioned that we only have it in English right now. But if we want to sort of move into the senior market, I think having the language capability is extremely important. And that's why before we think about providing Mindline for seniors, we need to first ask ourselves whether we have the capability to be able to address all of their needs. So at this point, no, there is no Mindline for seniors, but they can still use Mindline.sg, which is applicable for the general public. Okay, moving on to the next question. Is this platform open for other NGOs to collaborate? Yes, but I'm always open to hearing potential collaboration ideas. So that's part of my job. I lead partnerships, right? So if you'd like to sort of understand more, or if you'd like to find potential opportunities, you can sort of email me. I will type my email into the chat. Oops, sorry, wrong one. Okay, this is the one. So for the person asking the question just now, if you're looking for collaboration opportunities, just email me and reply to you, and we can take it offline. Okay, there's another question. Since there is no sign-in, every time someone accesses, it will be like a new candidate. Is that correct? Or how do you customize without identifying the user? I love this question. Very good question. You are half correct, right? So every time someone accesses, in the browser itself, we track them using cookies. So cookies are sort of little IDs that your browser tags to you every time you visit a website. That's why all your airplane tickets are so expensive, right? Or hotel room bookings are so expensive because they track you. We track you also, but we don't know who you are. You're just like some long number to us, right? So when you sort of assess Mindline, we know that, okay, this person assessed Mindline today. Right? If you come back tomorrow using the same device and same browser, we can track you as a return user. So that's how we categorize our usage patterns. We know that, oh, there are X percentage of people who are return users. We know X percentage of people are new users. So that's how we track. But if you use another computer or if you use another phone to access Mindline, then yes, it will be like a new user. So we will not be able to know that Caleb has 5 devices and I use 5 devices to access Mindline. So that's something that we can't do. But how we are able to track is through the cookies. If you use the same browser, same device, we'll be able to track you as a return user. So I hope that answers the question. Moving on to the next question. Does MOH conduct corporate talks to share on those mental health resources and support you have mentioned, or can share the presentation? I think Emmeline can share the recording of this session later. But MOH don't really conduct corporate talks. I think HPB does it. So HPB, if you go to HPB has this workplace outreach wellness scheme called WOW for short. So they provide a lot of corporate well-being talks and resources that you can get by applying with them. So if you go to HPB's website, I'll just type it here. You can Google this, HPB WOW scheme, and they would be able to provide some corporate talks for you. Okay. Okay, so moving on to the next question. So how do we help a young adult who is not working but locks himself in his room and plays computer games all day long? He also refuses to receive help or nor wants to talk about it. How do we help such a person? Again, this is a very clinical and psychology question, and I'm not a psychologist, I'm not a clinician, but I'll try my best to answer this question. I think the important thing is to see if this person needs help. If the person, a young adult, feels that, again, it also depends on how old a young adult is. I'm assuming the person is of working age and has graduated. I think it's important to understand what they are looking for in life. I think I am also assuming that you're asking this from a parent's perspective, right? So if I'm a parent and my kid is sort of locking themselves in the room, playing computer games all along, I think it's important to understand why they're doing that and what's in it for them. You can sort of ask them, and the way I sort of communicate with my kids, right, is that I play their games with them. I mean, it may be a bit hard. Maybe your young adult child might not sort of want you to play his game with him, but this is one way I think you can get into their frame of mind. Because when you're playing computer games, you're in the frame of mind. So you are doing certain things, you are very focused on playing the game. So you will not be receptive to any sort of external help. So one way you can try is to sort of talk to them in their own space and ask them, what do you want to do in life? How can I help you? So I think that's something that you can try. Oh, okay. There's obviously someone from HBB here. Very good. Okay, last question. I think we are at 1 o'clock and I have the last question to answer. But on the seniors topic, so my life for seniors. I'm reading the question. Perhaps you are assuming that seniors will only be comfortable with one of the mother tongue languages. There are many seniors like myself who are digitally savvy, conversant in English, and interested in being able to refer friends to Mindline for seniors in English. That's great, and I think that's something that we would want to be able to find. And for this person who is answering the question, I would love to talk to you more about Mindline for seniors. It's something that we have been thinking about, but again, there are many sort of thoughts that hold us back because we want to be able to create something and be of use to our target audience. So if you could sort of contact me or at my email address, I'll be interested to talk further on how we can cater to the senior target audience as well.